Welcome to our daily healthcare news deep dive.
It's January 25th, 2025.
And wow, today we've got a lot to unpack.
We do.
Headlines are revealing a healthcare system grappling with some really major stuff.
Yeah.
Financial strain.
Definitely.
Political upheavals.
Mm-hmm.
And, of course, this looming potential of AI.
It's a really fascinating mix, I think, of challenges and opportunities. We see hospitals struggling to stay afloat,
right?
And at the same time, you have AI being touted as like the cure-all.
It's like we're standing at a crossroads.
Yeah.
One path leads to these like exciting advancements, right?
Right.
But then the other leads to these like deepening inequalities.
Yeah, I see that.
So let's just dive right in.
Okay.
Let's start with AI.
Okay, so one story that really jumps out at me is this bold prediction by Dario Amodei, CEO of Anthropic.
Okay, yep.
He believes that AI could double human lifespans. Double.
Wow.
In the next 5-10 years.
Okay, that's a game changer.
Huge, yeah.
I mean, what makes him so confident?
He points to the rapid advancements in AI, particularly in the field of biology.
Okay.
So imagine a world where AI helps us understand and treat age-related diseases.
So we're talking like, AI helping us cure things like Alzheimer's,
potentially
Parkinson's.
Yeah, things that we can only dream of treating today.
That's pretty mind-blowing.
It is.
I mean, are we really on the cusp of such a dramatic shift?
Wow.
I mean, it seems pretty far out there.
Even the CEO of the Mayo Clinic,
okay,
while acknowledging AI's potential, is urging caution.
Okay.
He warns that it would be a shame if we don't harness AI responsibly.
So it's not just about the can we,
right.
It's the should we.
Exactly.
And speaking of this whole AI landscape, it seems like the U.S. isn't the only player in the game.
Not anymore.
Right.
No.
So there's an article about this DeepSeek open source model.
Yes.
It's highlighting China's rapid progress in AI.
It's very impressive.
So DeepSeek, for those of us who don't know, what is that?
Well, it's a powerful AI system that could rival U.S. advancements.
In healthcare specifically.
The healthcare, yeah.
So we have this potential for AI breakthroughs.
We do.
But it's also becoming this global competition.
It is.
I mean, where does that leave the average person?
That's a great question.
It's a lot to consider.
It is.
Okay, well let's shift gears from the future to the current reality.
Okay.
Hospital finances?
Yeah.
Not so optimistic there.
Not really, no.
A report that we saw highlighted a surge in hospital deals in 2024.
I saw that.
With a record percentage involving what they called financially distressed hospitals.
Yeah.
So it seems like a lot of hospitals are struggling to keep their doors open.
A lot, yeah.
It's heartbreaking to hear about these financial strains. I mean, what's causing this?
There are a lot of factors. I mean, you have rising operating costs.
Of course, yeah.
Labor shortages.
Yeah, we've been hearing a lot about that.
And just changes in how healthcare is delivered these days.
And sadly, this financial instability is hitting close to home, right?
It is, yeah.
The article about hospital layoffs in Pennsylvania, really a stark reminder.
It is.
Of the human cost of all of this.
It is.
The closure of Sharon Regional Hospital.
Over 800 jobs lost.
It's a devastating blow to that community.
It is.
And a worrying sign for the future.
Yeah.
It's a reminder that behind these statistics, there are real people.
Right.
Real families.
Absolutely.
Who rely on these hospitals for their livelihood and their healthcare needs.
Indeed.
And the situation could become even more precarious.
Uh-oh.
Right?
Yeah.
If the proposed Medicare cuts by Republican lawmakers go through.
That's the concern. Yeah.
And speaking of Medicare, the future of the Inflation Reduction Act and its impact on Medicare.
Big question mark.
Yeah, it's uncertain.
It is, under the new administration.
Yeah, there's a lot of anxiety about potential changes.
A lot.
And what it could mean for patient access.
Absolutely.
So this financial uncertainty coupled with potential cuts paints a pretty worrisome picture.
It does.
But amidst these challenges, there are some interesting developments.
There are.
In how healthcare is delivered and financed.
Take Mark Cuban's company.
Okay.
Cost Plus Marketplace.
Plus Marketplace, yeah.
They now offer over 6,000 medications.
Wow.
directly to healthcare facilities.
That's a pretty intriguing approach.
It is.
Could this be a way to reduce drug costs?
It could be, yeah.
It's an initiative worth watching.
Definitely.
It's a glimmer of hope in an otherwise challenging landscape.
It is.
Okay, speaking of challenging landscapes,
Okay.
let's talk politics.
All right.
Because the political arena is generating a lot of headlines.
It is.
With implications for healthcare. Let's start with President Trump's decision to halt activities in some public health agencies.
I saw that.
This includes the NIH and CDC.
Yeah.
For review.
Right.
This has sparked a lot of concern.
It has.
Among public health professionals.
Understandably.
They're worried about the potential impact on research.
Yes.
And disease prevention efforts.
Of course.
Especially given the recent pandemic.
Yeah.
It raises questions about the administration's priorities.
It does.
What's the rationale behind this decision?
Well, the administration says it's just a review of protocols.
Okay.
But many see it as a potential step towards restructuring or defunding.
It's definitely something to keep an eye on.
It is.
And on the international front,
yeah,
the Trump administration's plan to withdraw the U.S. from the World Health Organization,
the WHO,
continues to face pushback.
It does.
From healthcare groups.
Yeah.
Their concern is that this move could undermine global health security and make it harder to respond to future pandemics.
A very valid concern.
It seems logical.
It does.
Right.
Yeah.
That withdrawing could weaken that global health security.
Right.
Wouldn't it make it more difficult to coordinate a response?
It would seem so.
Their argument is that a pandemic anywhere is a threat everywhere.
Exactly.
And that international cooperation is essential.
It is.
The recent pandemic showed us how interconnected the world is.
It did.
But some argue that the WHO has its own inefficiencies.
They do.
Right.
Uh-huh.
And that the U.S. might be better off working independently.
That's another perspective.
A complex issue.
It is.
With valid points on both sides.
Definitely.
And it's not the only controversial move by the administration.
Right.
Their stance on immigration is also creating headaches.
Big time.
For healthcare providers.
Yeah.
The article about how providers are struggling to navigate these state guidelines regarding interactions with immigrant patients.
It's a nightmare for them.
It sounds like a logistical nightmare.
It is.
For providers who are trying to provide care to all patients.
Right.
But also navigate this very complex legal landscape.
Exactly.
Imagine being a doctor.
Yeah.
Trying to treat a patient. But also worrying about potential legal repercussions.
Yeah.
It's a difficult ethical dilemma.
Absolutely.
It's a reminder that healthcare doesn't exist in a vacuum.
It doesn't.
It's deeply intertwined with political decisions and their consequences.
It is.
Speaking of political decisions with potential consequences,
President Trump has issued an executive order aimed at restricting health care for transgender individuals in federal prisons. This order has sparked a lot of outrage.
It has.
Among advocates for transgender rights.
Of course.
Who view it as discriminatory and harmful.
Absolutely.
It's a highly contentious issue.
It is.
That touches on, these really fundamental questions.
Yeah.
About human rights and access to care.
Yeah.
It seems like every corner of healthcare is being touched by political decisions these days.
It does, doesn't it?
Is there any good news?
Well, amidst the turmoil, there are some leadership changes in the private sector. So United Healthcare has appointed Tim Knoll as their new CEO. Following the tragic death of Brian Thompson.
Hopefully he can provide some steady leadership during this transition.
I hope so.
It's a tough role to step into.
It is.
And across the pond.
The UK is facing its own set of challenges.
They are.
The NHS is dealing with a surge in norovirus cases.
Norovirus, yeah.
80% higher than last year.
That's significant.
Wow.
That's a lot.
80% increase.
Yeah.
That's significant.
It is.
It highlights the ongoing threat of infectious diseases.
Absolutely.
Even in developed countries with, strong healthcare systems.
Right.
It's a reminder that we can't let our guard down when it comes to public health.
We can't.
Okay. That was a lot to digest.
It was.
For one part of our deep dive.
Yeah.
I mean, we covered everything from AI revolutionizing lifespans to hospitals struggling to stay afloat.
I did.
And the ripple effects of political decisions.
It's a lot.
It's a lot.
Yeah.
We've seen a mix of
optimism and concern.
For sure.
Breakthroughs.
Yeah.
And setbacks.
Yeah, it's a mixed bag.
It is.
Welcome back to our deep dive.
One issue that's been weighing heavily on my mind is the maternal health crisis.
Oh, yeah.
The statistics are just alarming.
They are.
The U.S. has the highest maternal mortality rate among developed nations.
That's true.
And the disparities are even more striking.
They are.
When we look at race,
yeah,
Black women face a significantly higher risk.
They do.
Compared to white women.
It's a complex problem.
It is.
Rooted in systemic issues, like unequal access to quality health care.
Of course.
Socioeconomic disparities.
Right.
And implicit bias within the healthcare system.
It's heartbreaking and infuriating.
It is.
That in a country with such advanced medical technology, we're failing to protect mothers.
A vulnerable time.
During such a vulnerable time.
It is.
Are there any signs of progress?
Well, there are some glimmers of hope.
Okay.
The Hospital and Health System Association of Pennsylvania released a new action plan to address maternal mortality in the state.
But we need more comprehensive solutions.
We do.
At both the state and federal level.
Absolutely.
To really move the needle.
Yeah.
It's clear that this issue demands urgent attention.
It does.
And action.
It's not just about saving lives.
Right. It's about ensuring that all mothers have the opportunity to experience the joy of motherhood.
Without fearing for their own well-being.
Without fearing for their own well-being.
Exactly.
Okay, now shifting gears a little bit. Another concerning development is this proposal by South Dakota's governor to cut funding for medical residency programs.
I saw that.
This seems counterintuitive.
It does.
We're already facing a physician shortage.
Huge one.
Particularly in rural areas.
It's bad.
Wouldn't cutting residency programs only worsen the problem?
Well, it's a classic example of short-term budget considerations clashing with long-term healthcare needs.
So these cuts might save money in the short run?
They might.
But they could have dire consequences.
They could.
Down the road.
Yeah. As we face a growing shortage of qualified physicians.
It's a reminder that healthcare policy decisions often involve tough choices.
They do.
And trade-offs.
For sure.
Speaking of tough choices.
Okay.
Vermont is considering a bill to cap hospital executive pay.
Interesting.
This proposal reflects growing concerns about the rising cost of health care and the perception that some hospital executives are overcompensated while hospitals struggle financially.
Yes.
And patients face skyrocketing medical bills.
Makes sense.
It's a bold move.
It is.
That has sparked a lot of debate.
It has.
Some argue that it's necessary.
Okay.
To rein in excessive executive pay, while others worry that it could discourage talented individuals from seeking leadership positions.
I can see that.
It's a complex issue.
It is.
With valid arguments on both sides.
It really is.
It raises these fundamental questions about how we value and compensate leadership in healthcare.
Yeah, good point.
Okay, let's revisit the political arena again.
All right.
And delve deeper into President Trump's plans to withdraw the U.S. from the World Health Organization.
The WHO, yeah.
Healthcare groups are particularly worried about the impact this could have on global health initiatives.
Especially pandemic preparedness.
It seems logical.
It does.
That withdrawing from the WHO could weaken global health security. Wouldn't it make it more difficult to coordinate a rapid and effective response to future outbreaks?
Potentially, yeah. That's the argument being made by many public health experts.
They believe that a pandemic anywhere is a threat everywhere.
Right.
And that international cooperation is essential.
It is.
For effective prevention and containment.
The recent pandemic certainly showed us how interconnected the world is.
It did.
When it comes to infectious diseases.
But some argue that the WHO has its own inefficiencies.
There are some, yeah.
Right. And that the U.S. might be better off working independently.
I've heard that argument.
It's true that no organization is perfect.
True.
But the question is whether withdrawing from the WHO would ultimately make the U.S. and the world safer.
Or more vulnerable.
Or more vulnerable.
It's a critical question.
It is.
That deserves careful consideration.
It does.
Yeah.
Speaking of vulnerability, the Trump administration's stance on immigration continues to create a difficult situation.
It does.
For healthcare providers.
It's tough.
You're referring to the article about how providers are grappling with conflicting state guidelines.
That's a nightmare.
On how to interact with immigrant patients.
That is.
It puts them in a very difficult position.
They're in a tough spot.
It's almost as if they're being asked to choose between providing care and upholding the law.
Yeah, exactly.
Which creates an ethical dilemma.
Huge word.
For those committed to serving all patients.
Right.
Regardless of their immigration status.
Absolutely.
Imagine being a doctor who's sworn to do no harm.
Yeah.
But then being put in a position where you have to question whether treating a patient could have legal repercussions.
It's a tough spot to be in.
It's a stark reminder that healthcare is not immune to the political climate.
It's not.
And the political landscape is constantly shifting.
It is.
There have been some notable changes within healthcare organizations themselves.
Like
Providence, a large health system, is restructuring its executive team.
Okay.
And creating an Office of Transformation.
Interesting.
This move reflects a growing trend among health systems to embrace technological advancements.
Okay.
Especially as the realm of AI.
So they're getting on board with AI.
It seems like AI is rapidly becoming an integral part of healthcare operations.
It is, yeah.
It has the potential to improve efficiency, reduce costs, and even enhance the quality of patient care.
It does.
But as we discussed earlier, it's crucial to implement AI responsibly and thoughtfully.
Responsibly.
We need to ensure that AI is used ethically.
Yes.
And that it benefits both patients and providers.
Absolutely.
And speaking of the potential for AI to improve healthcare, the VA Secretary nominee has pledged to prioritize the deployment of Oracle's electronic health record system.
The EHR, right.
This is an interesting development.
It is.
Considering the rollout of the new EHR system at the VA has been plagued by delays.
It has.
And challenges.
A lot of them.
It will be interesting to see if the new nominee can get this project back on track.
It will be.
The success or failure of this implementation has significant implications.
It does.
For veterans' access to quality health care.
It does. Millions of veterans rely on the VA for their health care.
It's crucial that this EHR system is implemented effectively.
It's really important.
And speaking of access to care.
Yes.
We saw an article about a program designed to bridge insurance gaps for Native Americans. That has gone largely unused.
I saw that.
This is disheartening.
It is.
Considering the historical barriers Native Americans have faced in accessing quality health care.
Yeah, absolutely.
What's preventing this program from reaching the people it's intended to help?
Well, there are a few possible explanations. Perhaps there's a lack of awareness about the program.
Okay.
Or maybe there are logistical barriers preventing people from enrolling.
Okay.
Whatever the reason.
It's a reminder.
It is.
That even well-intentioned programs can fail to achieve their full potential.
They can.
If they're not implemented effectively.
If they're not, yeah.
It's a stark reminder that we need to do more to ensure that all Americans have access to quality health care.
We do.
Regardless of their background.
Absolutely.
Or circumstances.
That's really important.
We've covered a lot of ground in our deep dive today.
We have.
From the promise of AI to the realities of hospital closures.
It's a lot.
It's clear that the healthcare landscape is constantly evolving.
It is. It's dynamic.
It's a dynamic field.
Influenced by, well, everything.
I mean, technological advancements, economic forces, political decisions.
Social trends.
Social trends. It's a lot to keep up with.
It is.
And that's why we do these deep dives. Exactly.
To help you make sense of the headlines.
Right.
And understand what it all means for you.
The patient.
The patient, yeah.
So let's take a step back.
Okay.
And reflect on some of the key takeaways.
Okay, so key takeaways from today's news.
Yeah.
Give it to me.
Well, one overarching theme is this growing influence of AI.
We talked a lot about that.
We did.
It has the potential to revolutionize everything.
It does.
From diagnostics to drug development.
To treatment.
To treatment, yeah.
Imagine a world where AI can detect diseases earlier, personalized treatment plans, and even extend our lifespans.
I mean, that's incredible.
The possibilities are huge.
They are, but with these possibilities, right, come ethical considerations.
Of course.
We need to ensure that AI is used responsibly.
Responsibly.
And that it doesn't exacerbate existing inequalities.
Exactly. We have to be mindful of that.
In healthcare access. Yeah, and the potential for misuse,
The potential for misuse, of course.
And unintended consequences.
Yeah, we don't want to create more problems.
We don't.
Trying to solve the existing ones.
Exactly.
Another major takeaway is the financial strain on hospitals.
Big time.
Closures. Layoffs. Mergers.
Becoming more and more common.
It's scary. I mean, it raises serious concerns about the long-term viability of our healthcare system.
It does.
And the ability of hospitals to provide quality care.
To everyone who needs it?
To everyone who needs it, yeah.
Absolutely.
And of course, the political landscape
always there
is adding another layer of complexity.
It is.
Decisions about public health funding, Medicare, immigration.
Yeah.
It's all connected.
It all is. It all has an impact.
A direct impact on patients and providers.
Oh, sure.
It's a reminder that healthcare is deeply intertwined with politics.
It is.
And that policy decisions can have far-reaching consequences.
They can. They really can.
And we also can't forget about some of the other ongoing issues.
Right, the ones that don't get as many headlines.
Right, like the maternal health crisis.
Yeah, it's still a crisis.
The persistent physician shortage.
And the challenges faced by Native Americans.
In accessing quality care.
Absolutely systemic issues.
These are systemic issues.
They are.
They require sustained attention and action.
They do. We can't let these things fall by the wayside.
We can't.
It's easy to feel overwhelmed.
It is.
By all of this.
Yeah.
The challenges facing healthcare today.
It feels huge.
It is huge, but we have to remember that we all have a role to play.
Okay, so what can the average person do to make a difference?
Well, first and foremost,
stay
informed.
Okay.
Engage in conversations about healthcare policy.
Okay.
Advocate for policies that promote access to quality, affordable care.
Okay.
For all.
For all, yeah.
And don't be afraid to ask questions.
Ask questions.
Okay.
And challenge the status quo.
So it's about being an informed and engaged citizen.
Exactly.
Healthcare is a fundamental human right.
It is.
And it's up to all of us to ensure that our healthcare system is equitable, accessible, and sustainable for generations to come.
Absolutely. Well said.
Well, on that note, I think we'll wrap up this deep dive into today's healthcare news.
A lot to think about.
A lot to think about.
There is, hopefully, this has been helpful.
We hope you found it insightful and informative.
Yeah, remember.
Knowledge is power.
Knowledge is power.
And by staying informed,
right,
you can empower yourself to make a difference.
Absolutely.
Until next time.
Until next time.
Stay curious.
Stay engaged.
And stay engaged with the world of healthcare.
We'll see you then.